Hi, today we're delving into a topic that's often misunderstood but incredibly important. Complex post-traumatic stress disorder, or CPTSD. So what exactly is CPTSD? Unlike traditional PTSD, which can develop after experiencing a single traumatic event, CPTSD stems from prolonged exposure to trauma, often in interpersonal relationships or abusive environments. Some examples are childhood abuse or neglect, domestic violence, and sexual abuse. You may especially be more likely to develop complex PTSD if you experienced trauma at a young age or were harmed by someone close to you whom you trusted. Let's explore 10 signs that may indicate someone is struggling with CPTSD. Sign number 1, repeated flashbacks. Individuals experiencing flashbacks may feel as if they are reliving the trauma, with the sensory details and emotions of the event flooding back as if it were happening in the present moment. For example, a person who experienced childhood abuse might suddenly feel as though they are back in that abusive environment, experiencing the fear and helplessness all over again. These flashbacks can be triggered by reminders of the traumatic event, such as certain sounds, smells, or situations, and they can be distressing and disruptive to daily life. It's crucial to understand that these emotional responses are often linked to past traumatic experiences and may not align with the current situation. Sign number 2, hypervigilance. People with CPTSD may constantly feel on edge, as if danger is lurking around every corner. This hypervigilance can manifest as difficulty relaxing, trouble sleeping, and an exaggerated startle response. For instance, a combat veteran may find it challenging to adjust to civilian life, constantly scanning their environment for potential threats, even in safe surroundings. This heightened state of alertness is a survival mechanism developed in response to past trauma, but it can significantly impact daily functioning. Sign number 3, dissociation. Individuals with CPTSD often dissociate as a way to cope with overwhelming emotions or memories. This can involve feeling detached from oneself or one's surroundings, experiencing memory gaps, or even losing track of time. For instance, a survivor of domestic violence may dissociate during arguments with their partner, mentally removing themselves from the situation to cope with the trauma. Dissociation can be incredibly distressing and may occur in response to triggers related to past trauma. Sign number 4 is difficulty trusting others. Due to past experiences of betrayal or abandonment, individuals with CPTSD may struggle to trust others, even those closest to them. This can lead to difficulties in forming and maintaining healthy relationships. For example, a survivor of childhood neglect may struggle to trust their therapist, fearing that they will be judged or rejected. Rebuilding trust takes time and patience, but it's essential for healing from CPTSD. Sign number 5, feelings of shame and guilt. Individuals with CPTSD may experience overwhelming feelings of shame and guilt, even if they were not responsible for the traumatic events they endured. For example, a survivor of sexual assault may blame themselves for the abuse, leading to feelings of worthlessness and self-hatred. Sign number 6, self-destructive behavior. Coping with CPTSD can lead to engaging in self-destructive behaviors as a way to numb emotional pain or regain a sense of control. This may include substance abuse, self-harm, or reckless behavior. For instance, a survivor of childhood trauma may turn to alcohol or drugs to cope with intrusive memories and flashbacks. Remember, recognizing the signs of complex post-traumatic stress disorder is the first step toward healing and recovery. If you or someone you know is experiencing these symptoms, please reach out to a qualified mental health professional for support. Now let's have a look at coping behaviors in PTSD and complex PTSD. Individuals with PTSD or complex PTSD often adopt coping behaviors to manage their symptoms and alleviate distress. These behaviors may manifest in various forms and serve as attempts to navigate the challenges posed by trauma-related symptoms. Some of these behaviors include substance misuse. Some individuals may turn to alcohol or drugs as a means of self-medication to numb emotional pain or alleviate distressing symptoms associated with PTSD or complex PTSD. These coping behaviors often arise as adaptive responses to the distressing symptoms of PTSD or complex PTSD and may provide temporary relief from emotional distress. However, they can also perpetuate harmful cycles and further exacerbate underlying issues if left unaddressed. People-pleasing. Individuals may engage in people-pleasing behaviors, such as avoiding conflict or prioritizing others' needs over their own, in an attempt to maintain relationships and avoid potential triggers or stressors. Defensive reactions. In response to perceived threats or criticism, individuals may exhibit defensive reactions, such as lashing out or becoming defensive, as a way to protect themselves from further emotional harm or triggers. Self-harm. Some individuals may engage in self-harming behaviors, such as cutting or burning, as a maladaptive coping mechanism to regulate overwhelming emotions or gain a sense of control over their pain. So, what treatment options are there? One common approach is talk therapy, where individuals can safely explore and process their traumatic experiences with the guidance of a trained therapist. Through dialogue and reflection, therapy aims to help individuals understand and integrate their past trauma into their present life. In addition to talk therapy, medication may be prescribed to address symptoms of depression, anxiety, or other associated conditions. Antidepressants and anti-anxiety medications are commonly used to help manage mood and alleviate distressing symptoms. Exposure therapy is another treatment modality, often utilized in addressing complex PTSD. This therapy involves gradually and safely confronting traumatic memories or situations in a controlled environment, allowing individuals to gradually desensitize and reprocess the associated emotions and sensations. Cognitive behavioral therapy, CBT, is another effective approach for treating complex PTSD. CBT focuses on identifying and challenging maladaptive thought patterns and behaviors that contribute to distress and replacing them with healthier coping strategies. Some therapists also incorporate eye movement desensitization and reprocessing, EMDR, into treatment for complex PTSD. EMDR involves recalling traumatic memories, while simultaneously engaging in bilateral stimulation, such as following the therapist's hand movements or listening to alternating sounds or taps. While the effectiveness of EMDR for complex PTSD is still under investigation, some individuals find it helpful in processing and reducing the impact of traumatic memories. Thank you for watching our video on complex post-traumatic stress disorder. Don't forget to like and subscribe. See you in the next video.